Hi, once again. Let me welcome you to another episode of Go Healthy, Save Money. Hi, I'm Dr. Adesanya. Today's episode is going to be a response to one or two DMs I got as a follow-up to our last video on prenatal care and nutrition. Let me state clearly that it is the most powerful creation to have life growing inside of. I don't think there can be a bigger gift. I got a question that, okay, when we go for prenatal care, when we go for antenatal care, we go, they just press and say you are okay, go. The same drug, the same time, the same. Can't we get to do that at all? Can we get to do that by someone that can come visiting? And we get that done in a lot of places, churches, mosques, some homes and all of that, and we're good. You don't nurture blindly. You don't, with faith, dress up in your house and close your eyes and start moving out because you know God is guiding you. You nurture with intention. That's taking me to the topic of today. Pregnancy complication and risk factors. How do you identify pregnancy complication? There are issues existing in the mother even before pregnancy. There are complications that comes as a result of the pregnancy. And there are complications that are spontaneous, unpredictable. The whole essence of prenatal care is to be able to take care of those pre-existing ones, to bring it to a level that it will not affect you when you are pregnant. To be able to take care of those ones that are as a result of the pregnancy. The whole idea of prenatal care is to be extra vigilant. Both the family, mother, and even the clinicians. When the baby is still forming, at the very early stage, when it's not grown yet, it can fall in labor. It's a complication. It can be as a result of the process of formation. It can be as a result of coexisting issue. It can be as a result of so many things or new events that are happening to you. Early prenatal care will definitely catch some of this risk on time and address it. Early prenatal care will definitely catch some of this. Okay, let me oblige you. Let me just quickly run through some of those things that if you are in that category, just note that they are pre-existing risks that makes you more qualified for prenatal care. Example, number one, age. As simple as it sounds, when you are well above 35, you are at a risk and you need to be closely monitored. Same also, when you are less than 19. When you are 18, you need to be extremely monitored, just like every other woman, but you need to be more closely monitored. When you are overweight and above, you are a high risk and you need to be closely monitored when you are pregnant. Twin pregnancy, multiple gestation, in our environment, it's something we love, especially even when they are identical. We're so passionate about it. We so love them. It's a thing of joy. However, the pregnancy is high risk. It's something that needs to be managed, monitored by an expert. So you don't sit back at home or call someone, I quote an unquote nurse, because I know a qualified nurse will not come and manage you at all. And if you're a smoker, if you take lots of alcohol, if you use substance, you're high risk. You're high risk, even if it's part of your plan to completely do away. Like we've had some patients, some clients, they will say, oh, during this pregnancy, I am not taking it. Even if that's part of your plan, your pregnancy needs to be closely monitored because there are some effect of what you've been doing as a habit in the past in your body. So you need to be closely monitored. If you've had a history, you've had a pregnancy before, either you lost the pregnancy or you had a preterm birth, you delivered the baby before its time, or you had a complication either as a result of hypertension, placenta separating, you are a high risk. Just please present yourself to a gynecologist in conjunction with midwives. They will take good care of you. They will closely monitor you to prevent such things from happening to you again. The fact that I have listed some things that make women high risk. If you find yourself to be among, it doesn't mean your pregnancy will have any problem. Just like some women without risk can have their pregnancy go smoothly, even unmonitored and delivered, while some without risk at all, low risk, come out with lots of terrible complications. So the essence of knowing your risk factors, knowing the category where you fall, to know how closely you need to be monitored during the course of your pregnancy in order to have a smooth pregnancy, labor, and delivery, which is our goal as caregivers. Now, to reduce all of this risk requires that you do all we've been discussing, and also improving your health, taking a lot of water, having adequate rest, moderate exercise that is compatible, that is good for your body. All the social media videos that you see with some high intensity exercise, even while some of them are pregnant. Some of them are athletes before getting pregnant. They do it, even they can do some of those things while sleeping. So just seek advice from your doctor, the best form of exercise that you can do regularly and you can be consistent with, that can help your situation. You need to learn from your doctor, from your caregiver, from your midwife, the warning signs. There are warning signs in pregnancy. Bleeding. When you're pregnant, you see blood. Some will tell you, I was pregnant and I was still seeing my period. Once you're pregnant and you have done a pregnancy test and it's positive, you've done a scan, you cited the pregnancy, it's bleeding, that's no longer menstruation. So any form of bleeding in pregnancy is a warning sign. You need to get in touch with your caregiver immediately for close monitoring or for evaluation and onward management. Anytime you see water, when you are a bit heavy, you run to the hospital, because there are complications that can come with it, that the baby will have less than 10 minutes if you don't get to the hospital. There are warning signs. Pay attention to them. There are various other concerns like the movement of the baby. These are warning signs. Call the attention of your doctor by visiting immediately. My beautiful people, while complication can be very scary, most pregnancy goes without complication. In other words, most pregnancies are healthy. So you need to stay positive at all times, doing the right thing. By being informed, proactive, and supported, you can definitely have a healthy pregnancy. Attend checkups. Speak up about concerns, because you are not alone. Till we meet again, remember to subscribe, to like this video, to share with your loved ones, to make a comment. Feel free to DM me if you have other concerns, and let's go healthy and save lots of money. Catch you.